Hello everybody. Today I'm going to talk a little bit about jaundice of babies. Jaundice is extremely common, and you can hear that is so common in different time mainly babies. 6 out of 10 babies can have it. Yellowing of the skin and eyes. Common in the preterm baby. They born before 37 week. Jaundice usually develops second and third day after birth and disappear 2 weeks of age. And usually they are harmless. It should be, whenever there is jaundice, uh, I know it is worrying for carers. So basically, baby needs to be checked um, for within 72 hours of life. It is the best way to check jaundice is in the natural light if possible. Whether in natural light they appears yellow. Newborn baby, actually, if you think your baby has jaundice, important that level of that jaundice should be checked. In NHS we have midwives, they can do, and if it is within 24 hours of life, immediately their bilirubin level should be checked in the same day urgently, because it is has to be taken very seriously. Measuring the level of bilirubin very simply can be done, placing a device called bilirubinometer to the skin, and it won't hurt your baby. However, if the reading is high, and who is less than 24 hours old and very premature, less than 35 weeks delivered, they need blood test. And then doctors and midwives together decide whether that jaundice needs to be treated, and what kind of treatment will be best for your baby. So that is the thing, different type of in a way. Commonly we use a photo therapy, means a light therapy, that helps them. Very rarely they can need exchanging the blood, but level should be very high for that. Now here we will be telling you some of the red flag signs where you will be very worried or not worried or anything like that. So if you see your baby is pale, mottled, abnormally cold to touch, pauses in their breathing more than 10 seconds, grunting, and blue lips, or stiff, rigid, and makes repeated jerky movements of arms and legs, and it is not stopping when you hold them. It can be fit or seizure. Extremely agitated, crying inconsolably despite distraction, confused and very lethargic, that is difficult to awake. Under 3 months of age with temperature of 38 degree centigrade or 100.4 degree Fahrenheit or above, unless following vaccination, then you have to go to immediately hospital emergency, or in NHS call 999. Now in amber signs, when jaundice appear first 24 hours of life, very rapidly progressive yellowing, discoloration, skin, looks very pale and yellow, not interested in feeding, looks dehydrated like dry mouth, shrunken eye, no tears, drowsy, no wet nappies in 8 hours, sunken, top part of the, this called frontinelli, and that is also worrying. If drowsy, excessively sleepy, irritable, unable to settle with any toys, TV, food, or anything picking up. So that is also very, very, a bit of worrying. Extremely pale, chalk colored stool. Keep a sample to show to the doctor. Jaundice remain beyond 2 weeks of life. In case of premature, 3 weeks of life. Then you have to contact a doctor and midwife. immediately. Ring GP surgery or call NHS 111. If within 24 hours of life jaundice develop, send by midwife immediately and have their jaundice checked. If symptom persists for 4 hours or more and you have not been able to speak either of a member of staff from GP practice or to NHS 111, recheck that child has not developed any red features. Now, some green features when there is jaundice, assessed by healthcare professional and feeding very well, breast or formula, has plenty of wet nappies, continues to pass green poo on 2 or 3, changing to yellow, CD by day 5, breastfed baby's poo can appear CD. There is fat deposit within the poo and a reassuring sign that baby is feeding well. Baby wakes up and cries regularly for feed. So that care, in these cases, babies are okay. Continue providing child's, your baby's care at home. But if you are still concerned, you have to speak with health visitor or local pharmacist or call NHS 111 for review. So hope this little, talk will help you to recognize. Now, you may have questioned why my baby get jaundice. Because babies born high level of red cell in their blood. After birth, that red cell break down, produce yellow pigment called bilirubin. Normally, that is removed by liver. But if they have, they have the immature liver, can take 2 weeks for the bilirubin to be cleared. Breastfeed can cause mild jaundice as well, but the benefit of breastfeed outweigh the mild jaundice. A small number of cases may be underlying reason for severely jaundiced. Include blood group incompatibility of mom and baby and high level of RBC in the blood, genetic problem of blood cell. So if you have any such problem as your as mom in your blood, then baby may need special care. Sometimes it can persist beyond 2 weeks and 3 weeks in preterm baby. If this happens, likely to go to hospital for finding out why there is delayed this to resolve this jaundice level. So in most of the instances, that is that physiological and breastfed jaundice that not cause any problem to the baby, but prolonged jaundice, in that case we have to think about infection, viral or bacterial, metabolic condition, on liver problem, means any anatomic problem in the liver, on other rare conditions. And you may have the question how you can check the jaundice of the baby. Usually gets a full examination within 72 hours of life, and usually that time baby's jaundice can be picked up. In most of the cases not seen immediately by healthcare professional or need any treatment unless there is red or amber sign. I told you that is there. If amber sign, you have to immediately contact healthcare professional. If red sign, you have to go to emergency department of hospital. Thank you for listening. Hope this will help a bit about what to do and what you expect in a jaundice baby. Bye for today. We'll come with another topic next time.